I'm looking for new ways to engage the patient community with the healthcare sector. The goal, though, is not just be intermittently included. Basically, to get the most out of patient insight, you need to be connected from the very beginning and to the end. And you need to be able to have that raw feedback, unfiltered feedback. That's the key.
So welcome to the Merakoi Voices podcast. To this episode, the podcast is where we are talking to leading patient experts. And our focus today will be patient-led research. I'm Sandra Gear. I'm an insights lead at Merakoi, and I'm joined today by Gary Ho, who is an expert in gout. And we will learn a little more about him in a minute. So why are we doing this podcast? The thing is that if you've ever worked in healthcare, that could have been in research, in the industry, or in patient advocacy, you've probably heard the phrase patient engagement more times than you actually can count. Maybe you've even been part of an initiative to bring in the patient voice into anything. But if you're honest, has there never been anything missing? Because the thing is that too often patient engagement feels one way. For instance, we are asking patients for their journeys, for their experiences, their struggles, their perspectives. They are giving us answers through surveys, in-depth interviews, they join focus groups, they're sitting on expert panels, but then usually the conversation moves on without them and the decisions are made somewhere else. And for the people who are most at stake, the people that are living with their condition, they are often left wondering whether their insights, their feedback has made any difference at all. So what if we stopped treating patients just as input providers and started seeing them as what they actually are, partners and experts? And they are experts not only in their own or on their own experience, but also navigating the system around their disease for a long time and on an everyday basis. So what if, instead of just extracting knowledge from patients, we started actually building with them as co-researchers, as partners, and as contributors who can help us shape the future of healthcare? And this is actually why I'm so excited to be talking to Gary Ho today. Welcome, Gary, and thank you for making the time to join us today, because Gary isn't just advocating for better care. Gary is actually proving what is possible when patients take the lead. He's the founder of the Gout Support Group of America, and he has built a community of over 16,000 people. And he has helped turning patient experiences into real-world insights that researchers and healthcare leaders couldn't ignore in the past and hopefully won't be able to ignore in the future. So he's worked directly with researchers, he's worked directly with the industry, and has helped to move beyond just token patient involvement and to create true collaboration. So, which is why he is joining us today, because we want to learn more about the gap between listening to patients and actually working with patients. We want to understand why it is that healthcare is still struggling so much to treat or include patient expertise as the real expertise. We want to understand what's actually possible when patients are really embedded in research and not just consulted after the fact. And we would like to have your advice on what it would take to make this the standard and not just the exception. So this is what we're here today to talk about. And I'd like to jump right in. Gary, we have just finalized a research project that was commissioned by the industry about gout, where Gary was our patient expert. So he was from the beginning providing us with a very in-depth insights and understanding around gout and living with gout. He was co-designing the research material with us. He was shadowing and helped us shape the interviews, the conversations that we had with patients on the research topics. And he supported the research findings from his unique experience as being an expert on gout. So, and you've had the feedback, and we've had the feedback also from our client, how invaluable your contribution was for this project, not just because it allowed us to gain so much more depth and so many more insights to uncover, but also because it allowed us to really give the client actionable insights that they could understand where they were actually coming from and could use to build. So we can talk about this example not too much today, because everything we do for clients is, of course, confidential. But I'd really like to have your perspective today, how a patient expert works in a Merakoi project. And so my first question I'd have to you is, how do you feel, or was your experience, how the patient insights and the patient expert contribution can help uncover blind spots that traditional research methods miss?
I appreciate that. And first and foremost, thank you for having me today. It's a pleasure to be here. I have lived with gout for over 30 years, and my first experience with this disease was at a very young age. And so I know the struggle of being a patient and wanting to be heard. I know it personally. And from this journey and moving over to patient advocacy, I've been able to see that there has traditionally been a gap between the patient community and the healthcare industry. For whatever reason, it seems to be that in the past, maybe not so much now, because I think industry is slowly learning, right? They're learning. But typically in the past, the healthcare industry would see and view the patient community as basically recipients of the therapy or whatever they are working on. And patients would be, used in a token capacity here or there, but really never taken seriously in the projects. And I'm so excited to be able to talk with you about this topic. And really being involved with Merakoi was such a pleasure, because there are very few companies out there that understand the importance of the patient's voice when it comes to strategy, when it comes to just looking for a patient-centric solution for their community. When I think of the patient community, I think of experiences. I think of lived experiences. Basically, the bottom line is we as patients or people living with the conditions day in and day out, we are experts actually at this condition. We know the struggles day in and day out. We know what works. We know what doesn't work. And when industry is able to understand that concept and accept the patient voice, not just merely as anecdotal experiences, but collectively over time, and as you look at the trends and how we communicate and what is being said, there are real data points, scientific data points that can be used in a tangible way to really help bring what I think we're all looking for in this endeavor. It's quality of life for those that are living with certain conditions. Mm-hmm. And to be able to bridge that is so important. Merakoi is at the forefront of doing that. Groups like the Gout Support Group of America, we believe in partnering long-term partnering, wanting to make a difference. We understand that we have a lot of valuable data to give, and honestly, we want to give it. We want to share it, and we're just looking for industry to understand that and accept it. And I think we're well on our way. I think we're on that course, and I'm so happy to be able to talk about this topic.
Yeah, we're so happy to have you, because I've been a researcher with a lot of my heart going into patient and healthcare research for more than 25 years. And I've worked on all the stakeholders and also trying to bring the different stakeholder perspectives together by answering like the objectives, the research questions from the clients. So I come with a lot of experience, but like what's intriguing me to work for Merakoi and what I'm experiencing working with patient experts like you is how much more we can learn when we bring in the patient expert right from the beginning. So like we've had projects where a simple thing as someone co-creating a discussion guide with us helped us to understand where patients may be coming from, understand the language we need to use to talk to them. You also made us aware of aspects that are important, but that may not be in the conscious thoughts of patients, or that they are reluctant to talk about. And you made us aware how to incorporate that into our approach and to understand the difference. Knowing this will make later on when you kind of start creating more effective treatments, creating more support services. I mean, you and I have talked about how there's a lot of engagement happening across the industry from every stakeholder to include the patient voice, and how that's also difficult at points since there's regulations in place, there's data privacy in place. And we were talking about how important it is to continue building those bridges between pharma and patients. So can you talk a little more to like the barriers that you have encountered that prevent the real collaboration? You mentioned the lack of platforms. So what's your experience in here? And what's the gaps that you see? And from your experience, how can we bridge them?
Well, I think to answer that, I will touch on, I've identified 4 points that the patient community can actually offer. And I'm going to go through that and we can talk a little bit about that. As a patient expert, our patient communities, we can help industry uncover barriers and needs. That's probably the first important point that I want to make. Being able to identify daily challenges, decision-making factors, and gaps in care that often go unnoticed. There's a huge difference between book smart and boots on the ground experience smarts. And oftentimes I think, the healthcare sector relies a lot. They put a lot of weight on book smarts, and please don't get me wrong. I am happy and so glad that my rheumatologist has gone to, 17 years of schooling or however long, right, to get where he's at. He is my gout specialist. I refer to him and I work with him as a partner for my own health. Beyond that, though, he doesn't have gout. Right? So everything that he knows in theory, and so uncovering the barriers and needs, really to be able to do that, the industry needs to be able to connect and partner up with a group, a community that, again, boots on the ground that are living this condition. They will be able to tell you what is missing, what the true needs are, right? The second is solution experts. Mm-hmm. The patient community are solution experts, helping design recruitment strategies, education tools, and support programs that truly resonates with patients. Right? That is so important. You can create something, but if you create a therapy and you just miss the mark slightly, there's going to be very low responses. You're not going to get you're not going to get the results that you're looking for, which is, at the end of the day, again, that quality of life, ultimately, that we're all looking for. The third is the bridge building factor. Patient experts, patient communities are just automatically, they are bridge builders. They want to connect. It's not like the patient community wants to live on an island to ourselves. We want to be communicating with our researchers, with our pharma partners, and with the healthcare sector. We want to be able to bridge that gap. And the fourth is enhancing clinical trials, right? Because we know that clinical trials are so important. And personally, as a person living with gout, I went through a clinical trial early in 2010. When I was first diagnosed with gout, my condition was bad because I had a very hard time convincing the healthcare sector that I actually had gout. Through stigmas, they were not able to see past the medical textbook of what gout was. And so they were not able to hear what I was saying and my experiences. It took 16 years to finally get a diagnosis. Once I received that diagnosis, though, my unmanaged condition was pretty bad. Mm-hmm. At the time, there was a clinical trial. It was an infusion medication, an IV of sort. It was prior to being FDA approved. I was lucky enough to be presented with the opportunity to join. And at the time, I really contemplated the pros and the cons. And after discussing it with my family and also with my gout specialist, my rheumatologist, I joined the clinical trial. And through that experience, it's changed my life. Today, this medication is FDA approved, and it's changed thousands of lives. And I am proud to say that I was part of that journey for the trial. And so when it comes to clinical trials, it's very important for our community. And the patient community can add to this because we can address barriers that might exist, that might scare or make a participant reluctant to join, right? We know the questions that they're asking inside of their head. Mm-hmm. And so we can address this even before, right? Knowing that they're going to ask these questions, we can work with the pharmaceutical industry, with the researchers, with the healthcare sector to prepare properly, to be proactive towards designing this trial so that we can have better participation and ensure long-term engagement. Mm. These are the four primary things that, and I'm sure there's more, but that's four that the patient community, patient experts can add to. And that's why it's so key not to see us as token partners, but long-term partners. And it's valuable to include us from the beginning all the way to the end.
Absolutely. And you also mentioned that one of the biggest issues is that there's so few structured ways for pharma and patients to communicate openly, to collaborate. Like there's, of course, doing this patient-led in a patient-led way, which I've been part of the past couple of years, doing that through market research, doing that through traditional methodologies like surveys, focus groups, in-depth interviews is really valuable. But what would be your thoughts on how patient engagement can go beyond surveys and focus groups and classic market research methodologies? What's kind of the other ways that we can build this bridge and bring pharma and patients together? Like you've mentioned also, or you've done quite a few things in the past. Can you tell us a little bit about that?
Yeah, absolutely. So, traditionally, how the industry might try to involve the patient community are through, surveys, focus groups, right? And that's great, and they're good for what they do. I believe that they are limited, right? That process has
Exactly.
yeah, it's a limited way of getting information from the community. First and foremost, just when you talk about a survey, when you think about it, you send a survey out. It has some questions, that they ask, and sometimes patients are given a stipend to complete the surveys. Sometimes they aren't, but I think mentally inside when they're taking surveys, they might be thinking, well, what are the researchers wanting to hear from me?
Mm-hmm.
Right. And so they might have that in mind. And so it might skewer their answers just slightly. So I don't think you're getting the real accurate information, right? Because they're constantly thinking about, well, what should I be saying, right? Even though the survey might say, hey, please tell us exactly what you're thinking and don't worry about it. I think, just deep down inside where we as the patient community are thinking, what do I need to say to, what do they want to hear from me? So it's not pure, I think. It's not pure. To be able to have a platform that can really listen to the patient day in and day out and get that raw information, unfiltered information, if that's possible,
Mm-hmm.
is really I think the golden standard. And how we get there, I've been involved in partnering with other analytical companies in the past to where, we actually participated with an analytical company that used AI technology, for example. And the way that we conducted this was that we basically allowed AI with consent to monitor and look and really examine the conversations and posts that happens day in and day out.
Mm-hmm.
That's one example of how
Mm-hmm.
we've been able to do this. And through that, we were able to collect information and really, look at the trends through discussions, the words that are being used, how they're describing their experiences in the morning, in the afternoon, at night when it comes to gout, my disease, right? After eating certain things, how they felt. And so we were able to take all that anecdotal experiences, conversations, thoughts, and we were able to connect the dots, and we were able to see where the gaps were. That is one example. And as we move into the future, these are, I'm looking for new ways to engage the patient community with the healthcare sector. The goal, though, is not just be intermittently included. Basically, to get the most out of patient insight, you need to be connected from the very beginning and to the end. And you need to be able to have that raw feedback, unfiltered feedback.
Mm-hmm.
That's a key.
Yeah. Thank you. So, I mean, you have founded your support group because of the lack of resources and understanding that you encountered. You said it was born out of frustration because so many patients with gout feel dismissed, they feel misunderstood, and there was no support community, and it's now really growing, or has been growing, into a movement, like you said. And you also say that there's so much power behind the community driven solutions. Can you tell us a little bit of how the initiatives you've been involved in have made a difference for the different stakeholders, like for the patients from the community that have been involved, for you, if you've mentioned the trial already, but also for like the other stakeholders in those initiatives? What's the difference it has made?
The Gout Support Group America was born out of, like you said, frustration. And really, in 2015, when after 5 years of successfully now managing gout, after being diagnosed in 2010, right, I was reflecting on my journey, and I thought, wow, from 1994 to 2010, that was 16 years. I was 24 years old when I first experienced a gout attack. And that was just walking across campus as a college student back in the day. Immediately, I knew something was wrong. Mm-hmm. And I called my dad up and I said, something is wrong. My ankle feels like it's broken and I did not do anything. And it hurts so bad, Dad. I don't know what to do. And he says, Gary, I think you might have gout. You know, gout runs in our family. I have gout. Your grandfather has gout. You need to go see a doctor. I did so. 2 weeks later, I was in to see my primary care physician. And at the time, being 24 years old, and I vividly remember walking into his office and telling him everything I just told you. And he kind of leaned back in his chair and he said, sir, you don't have gout. You're way too young to have gout. You probably were just a little bit too active. Maybe you hurt yourself and you don't remember, but I'm going to prescribe you some pain medication. It'll probably go away. Don't worry about it. I mean, I felt a gamut of mixed emotions. First and foremost, I felt over the moon happy because I don't have gout, whatever that was. I didn't know what gout was. It sounded ugly and I didn't want it. And I thought I won the lottery. Great. But as time went on, the pain and the attacks came back, and they came back with intensity over time. And so that experience just repeated itself for 16 years. And ultimately, I felt like I was medically gaslit. Mm-hmm. Like I didn't have a voice. My experience didn't matter because textbook knowledge overrode experience. It wasn't until 2010 when I met a rheumatologist and I shared with him what I had been going through. He was able to piece all the different puzzles together and saw a big picture. And that was when he ordered a blood test. And by the way, all it was a blood test. And I couldn't even get a blood test to see if I had gout.
So there's kind of like lots of points and pieces where there's a lack of understanding the patient.
Well, that's the point with these diseases that people are living in. It's typically not just one thing that you can look at, right? It's typically pieces that you have to put together to see the big picture, right? And that's why in 2015, I thought, man, those were some dark days for me. I felt isolated, not only physically in pain, but mentally isolated, mentally distraught. And I thought, how many other people are like myself? And that's basically how the Gout Support Group America came to be. I started this support group because I want to empower the patient community to voice up, right? If we are not advocating for ourselves, no one is going to advocate for us. Yeah. And it's okay to speak up. And beyond that, though, our group has grown beyond just being a support group, though. Now we're involved with making a difference within the aspect of managing gout. Through our data analysis, for example, we were able to show a clear difference between proactively managing gout and looking at the cause versus treating the symptom, which I call a reactive way of managing gout. And that was for Gout Support Group America, we were at the forefront of making a difference. We changed conversations within the healthcare industry. We've been able to put out white papers. We've been able to put out research articles that are, housed with NIH, for example. You can do a search on reactive and proactive management of gout. You'll find the influence that the Gout Support Group America had been able to do. And that's an example, right? That's one example of what patient communities can add to the healthcare industry.
Thank you. Thank you so much. We're almost at time, and you also mentioned that it's so important to move to that proactive stage, like to not just being passive, but patients becoming active partners for not only the results being better treatments, but also for a healthcare system that works for everyone that's involved, since you have a much better insight into what's happening. You also mentioned whether someone is staying in a clinical trial or consents to taking part in a clinical trial, keeps on taking their medicine, understand what they need to do. It's so important to gain the in-depth insight into what it is or what it means living with a condition. As you say, it's like the day-to-day experiences that you have. And I really love that sentence that you gave me, that you say true patient centricity isn't about checking a box. It's about embedding the patient voice into every stage of healthcare development.
Yeah, absolutely. 100%. If I can say anything to the industry, I would say this, Merakoi is a company that is proactively looking to engage and to bridge that gap between the healthcare industry and the patient community. I think that term being proactive goes beyond gout and managing gout. I think it should also be embraced by the industry as a whole. When we approach just clinical trials or just trying to gather information for a particular therapy, we need to be proactive with that approach. A reactive approach is really involving patient communities, patient experts after the fact. That's reacting to, right? That's very much like, hey, we will involve them now because we are experiencing some issues, some problems. We are now going through a hiccup, so let's bring somebody in. Hey, we can avoid all that. Just like you can avoid gout flares by being proactive, we can avoid all that by being proactive and allowing the patient experts to come in and be that interpreter, right? We are interpreters. We interpret what the patient community is experiencing and saying so that the healthcare industry can understand. And so if we can take that proactive approach, I promise you, it's almost without doubt that you'll have better results ultimately with the therapy or whatever it is that you're looking to do.
Thank you so much for this, Gary. It was such a pleasure to have you here and to learn from you again. And I hope we can continue this learning from you in the future. Thank you so much for your time today.
Pleasure being here. Thank you for having me as a guest.